Tonight on This Week in Politics.
We didn't used to hear the words heroin and fentanyl, and now we do, and there are people in our community dying from it.
An in-depth interview with Minnehaha County Sheriff Mike Milstad. He's helping spearhead an effort to develop a community triage center for those with drug addictions and mental illnesses, while at the same time watching an increasing number of drug overdose deaths here in the county. Good evening, everyone. I'm Brian Allen. In many of our recent interviews, the issue of drug use and abuse has come up, and not because there's nothing else to talk about. Meth, heroin, fentanyl are increasingly becoming a part of the daily routine for police officers and sheriff's deputies all across our region. I began my conversation with Sheriff Milstad by discussing plans for a community triage center. For nearly a year now, the idea of a community triage center to service those in crisis in both Sioux Falls and Minnehaha County has been bandied about and discussed. Those discussions do continue to move forward, but two of the people involved in the process have told us in recent months that while there has been a lot of talk, there has not been a lot of action.
No one is jumping up and down saying we want to be the host of this, but we all know it's an issue that we need to work together to help solve.
It can't be just about filling out grant requests and doing studies. We have to hit the road running and actually execute.
While Councilwoman Erickson and Commissioner Barth are voicing some frustration, Minnehaha County Sheriff Mike Milstad is tempering his response when I asked him about the process to get the doors open for a community triage center.
Government seems traditionally to move fairly slow, and this is a fairly slow and thought-out process. There's been a lot of studies and a lot of meetings. I think that most of the people in the room now that have been coming to these meetings knows at the end of the day what we want, what we need to have in our community. It's finding that how's it going to be funded, who's going to fund it? Is it going to be just the government, which hopefully the answer to that is no.
Milstad tells me it is his belief that to get a triage center open and operational, it is going to require funding from several different sources, that it can't just be Minnehaha County and the city of Sioux Falls opening the purse strings, that it needs to include funding help from the two big health systems, Avera and Sanford, that it could possibly include funding from nonprofits and, in a perfect world, some federal funding as well.
I just see a lot of opportunities, but the devil's in the details, and that takes time.
As far as how a community triage center would work, Sheriff Milstad tells me it wouldn't necessarily be the final destination for someone who needs help, that perhaps the person in need would be brought to the center and receive an evaluation, and from there the person could be taken to a second facility that would help the person get the treatment they need, whether it be for a drug addiction or a mental health issue, or both.
We need a place where that person can be brought. Probably an alternative to having to put the person in jail, which in many cases it's not the right place. Probably an alternative to putting the person in the emergency room and crowding the emergency rooms, which for a lot of those people, it's not the right place.
The county, to a certain extent, already operates programs to help those caught in the grip of drugs and alcohol after they have entered the county's criminal justice system. Under a community triage center, those existing programs would be absorbed into the new one.
We spend hundreds of thousands of dollars on our detox and sobering center services already. Well, a lot of times people don't deduct that, because if it's done in the triage center, then we no longer have to do sobering center in the jail. We no longer have to do the detox center in the law enforcement center. So there can be some savings and transfer of that facility.
The money the county is currently spending on detox and sobering programs would be rolled into the operating costs of this new community triage center, which would likely be located somewhere in the downtown corridor. But when it comes to how much it would cost to build and then operate that community triage center, well, that is still to be determined.
I'm not ready to say, here's what I think it costs. I think our healthcare partners are going to come to the table. They've been at every meeting that we've held. And it's not just a county issue, although the county took leadership. It is, the city has been there at every step in the way. City council, the police chief and police department, the sheriff's office, county commission.
Next on This Week in Politics.
It's heartbreaking, it's heart-wrenching. It is something that keeps me up at night.
Sheriff Milstad says public awareness about the increasingly serious nature of drug use in our area needs to increase if it is going to stop. More of our conversation when we come back right here on KSFY.